I'm glad to share some of our presentations at ASH. One of them was presented at the oral session by Dr. Sambol, our fellow, looking at the two new proposed classifications for MDS. As the audience will know, there had been an update in the World Health Organization classification as well as the international classification consensus in 2022, and we tried to have a look at both of those classifications. Both classifications have similarities, but there are some subtle differences. I think the importance of those classifications that they are now recognizing, MDS or myelodysplastic syndrome entities based on molecular event. So we have a SF3B1 proposed entity, a TP53 proposed entity, and classically we had the deletion 5q entity, which was retained. But there are some differences in defining those. The other difference was that in the morphologic defined entities, the ICC eliminated ring sideroblasts, the WHO kept ring sideroblasts without SF3B1. The ICC maintained presence of multilineage dysplasia. The WHO eliminated that. And the ICC proposed that more than 10% could be considered an MDS AML group. So what we did is we took patients from our database, almost 2,200 patients, and we reclassified them by those two classifications and tried to look at the outcome and tried to answer questions regard of those fine differences between those two groups. So we first showed that, the WHO 22 predicted outcomes or groups reasonably in a very good way, that the patients with SF3B1 had the best outcome with a median survival approaching 110 months, and the ones that had a biallelic TP53 had the worst outcome. Similarly, we also showed the ICC subcategories, again showing that those molecularly defined entities are valid. MDS SF3B1 had the best outcome. TP53 had the worst outcome. In the ICC, there are two groups of the P53. One is the biallelic, and one is if the blasts are more than 10% with monohit of P53. And again, we showed that those two groups were associated with worse outcome. Now, we looked at the issue of presence of ring sideroblast without SF3B1 that was retained in the WHO, and we did not see a difference in outcome compared to MDS with low blasts, other types. So that was one finding. On the contrary, we found that presence of dysplasia in more than one line, or what we call a multilineage dysplasia, was associated with worse outcome. Then we also tried to look at the blast cutoff, what is the one that's relevant. And in our database, a myeloblast percentage more than 5% was more predictive than the 10%. More than 10% had worse leukemia-free survival, but the overall survival was really not difference between 5 to 9 and 10 and above. And we also looked at the presence of fibrosis in the bone marrow that is a proposed new entity by the WHO. If the myeloblasts were more than 5%, and we found that is associated indeed with worse outcome. So based on this, I think, and then we did a multivariable analysis showing really that, multilineage dysplasia, myeloblast percentage, fibrosis, SF3B1, and TP53 all predicted outcome, and the strongest predictor was basically the P53. So we are proposing kind of unified classification, combining those two, where we define patients based on molecular profile. So we have the multi-hit P53 as a unique entity. If the blasts are increased, then we have MDS with excess blasts. If there is fibrosis, that's MDS with fibrosis. If the blasts are not increased, then we have molecularly defined entities, deletion 5q, SF3B1, MDS with low blasts, and that could be multilineage or single lineage dysplasia, and hypoplastic MDS. And this was obviously work done in the context of the international working group for MDS. And we hope to validate this proposal in a prospective study from those centers.